televised, and I would ask that you please ensure that your phones are on silent mode. We'll begin today with the Board of Health meeting, and of course, public hearings will follow promptly at 3 p.m. With that, I will call to order the Board of Health. In terms of approval of the agenda, changes to the agenda, staff have requested that an agenda item be added to request the November 2nd, 2021 Board of Health meeting be rescheduled to Tuesday, November the 9th, 2021, commencing at 9 a.m. to accommodate a county budget committee meeting. The confirming bylaw 2021-21-BH was added to the agenda after publication. If I could have a motion to approve the agenda with the following amendments. First of all, the addition to reschedule the regular Board of Health meeting from November 2nd, 2021 to November 9th, 2021, commencing at 9 a.m. And confirming bylaw 2021-21-BH. Are there any other additions or changes to the agenda? Okay, seeing none, if I could have a mover and a seconder. Councillor Columbus, thank you. Seconded by Councillor Rabbits. All those in favor? And that is carried. Any declarations of pecuniary interest? Seeing none then, we just have the one presentation before the Board of Health this afternoon. Of course, our Acting Medical Officer of Health will be providing an update. And with that, I will turn it over to Dr. Strauss.
Thank you, Chair Chop. It's a pleasure always to speak to the board through you. It wasn't too long ago that we last spoke, but I guess I have a few updates. It remains a terrific job. It's been really interesting, and everyone that I've interacted with at the health unit has been marvelous. I'd like to separate my updates into COVID and non-COVID today. So as far as COVID goes, I'm pleased to report there has not been a lot of action. As per the last 2 daily status reports I've received, we've had 2 cases in the last 48 hours. Compared to recent history, this is good. Our contact tracing is under control. Our outbreaks are under control. And all this seems to be consistent with the broader provincial experience where cases are generally stable and declining in most health units. With respect to vaccination, we're continuing the same work. Looking at our recent historical rates, about every week in August, we vaccinated 1.5% of the eligible population. The first 2 weeks of September had an uptick, either related to vaccine certification or return to school, where we saw about 2.5% of the eligible population vaccinated those 2 weeks, each of those 2 weeks. We're now back to that, what you might consider a baseline rate of about 1.5% of the population every week. We're still continuing the same sorts of outreach. The GoVax bus is coming or already arrived at the Norfolk County Fair. And I am pleased to say that when I last spoke to the Health Advisory Board, including members from Halton, I think I said we were, and I was correct, we were 5th from the bottom of public health units for vaccination rates at that time. We've since moved up to 7th from the bottom, ahead of Hamilton, not that it's a competition. I watched the Chief Medical Officer of Health's announcement regarding rapid antigen tests with some interest. Great interest, let's say. I've already spoken with some of my regional colleagues about how we might operationalize that. Sorry, I don't know why I forgot that word. Locally, and certainly I'll be brainstorming with the team here at the Public Health Unit about what that might look like and when it might be affected, if it needs to be. That concludes about my COVID updates. And then I will say for non-COVID updates, certainly COVID's been top of mind. And so these are rather preliminary, but in the name of openness and transparency. Yep.
Sorry, I'll put it on the floor then if there's any questions related to COVID, perhaps make it a bit easier for you. Councillor Huffman, or Board Member Huffman, go ahead.
Thank you, Chair Chop. Through you to Dr. Strauss. With the GoVax bus, do we have an idea as to what would be a successful visit by the bus? Do we have a percentage? Do we have numbers in mind? What might we be looking at?
I think the application to have the bus preceded my time here, so I don't have those numbers offhand. I'm willing to be surprised. I think, well, let's say throughout the pandemic, prediction has been fraught. So I'm not willing to make a prediction myself, but I think any number is a good number.
Perfect.
Over our last number. So
Okay, no,
See.
I'm with you there. If we get 10 people, we get 10 people. But it will be interesting to see what the uptake is on that, whether we're getting first doses or people are going in for their second dose. So, and I just wanted to add that yesterday at the Norfolk County Fair, there are proof of vaccination tents there. So if you're going to go in the buildings, you need to show your ID, your photo ID, and your proof of vax, and wear your mask inside the building. So those were being attended to yesterday at the fair.
Member Van Riesche, go ahead.
Thank you. Through you. I was going to ask a question about the vaccination breakout. If you could talk a little bit more, what's the population increase or the number increase that you had from youth over 12? Like you said, you had a bit of an increase. It wasn't in that number. I'm just wondering how we're working out with the youth.
So in the 12 to 18 bracket,
Right.
I don't have a week on week update on that myself. That's something I can ask Dr. Bishop Williams, a staff epidemiologist. She's away this week, but those are numbers that she would have readily on hand.
Okay. Is there a plan? I haven't noticed a program or a program increase on trying to capture more of the youth population to get vaccinated.
Of course, there's the school clinics. Beyond that, I'm not. Is there a program you have in mind? I'm not aware of any hypothetical or in the works programs that way either. Is there a suggestion that you want? I'm
just wondering if the school boards have been in contact with you about some sort of pamphlets or interest programs, posters to try to increase that population to get their vaccination. Right.
And sorry, through Chair Chop to Councillor Van Riesche. Forgive me, I remain new to the role, so I'm not immediately sure what health promotion has been done in that population at this moment. So I can certainly follow up on that at our next meeting.
Okay, thank you.
Member Hoffman, or Member Columbus first, and then I'll come back to you, Member Hoffman. Sorry.
Yes, thank you, Madam Chair. And Dr. Strauss, I understand that you have met with some farmers who employ migrant farm workers recently. If you could bring us up to date on how things were received. Some of these growers are telling me now that they're already in the process of ordering up workers for 2022 production season. And they just want to make sure that there are no hiccups along the way as what we've had in the past. And any thoughts on ensuring that our workers that come to Norfolk are vaccinated
absolutely
before they get on the plane for next season?
Through Board Chair Chop to you, Councillor Columbus, thank you for the question. I have indeed been in contact with some farmers. I will say I've been in contact with a wide swath of community members so far, and I'm not. I don't want to write any checks I can't cash or make any promises I can't keep. But so far, everyone who's called the public health unit looking for me to call them, I have called back. So I have met with some farmers. I'm looking forward to meeting with some migrant worker solidarity groups as well. The farmers that I have met with have been extremely kind, professional, forward-looking, constructive in terms of the suggestions that they've made. My orientation with the public health unit, sort of the plan for it, has only been established and has not yet been undertaken. So I don't, again, in the interest of not writing any checks I can't cash, I certainly want to hear from our public health inspectors and the public health management about what perspectives they have on what 2022 might look like with regards to some of the migrant worker housing issues. I would say that whatever all gets landed on, I think has to be reviewed and assessed in the era of highly effective vaccination. That there was not a highly effective vaccine this time last year, and now there is. So I think that there's that the policies that are in place need to be considered in that light. I'm not sure in terms of the mechanics of making sure that workers who arrive are pre-vaccinated. It seems like a lot has already happened kind of ad hoc, and every farmer that I've spoken with so far has a proportion of vaccination among their workers much higher than the general population. So I will add that to the list of things that I perhaps the next time we speak, I'll have more understanding of how much is being operationalized in their home countries and whether we will even be accepting migrant workers who are unvaccinated. I don't have that information offhand. I think that dealt with most of your questions.
Thank you. I appreciate your proactiveness in this matter. Thanks.
Member Huffman, go ahead.
Thank you, Chair Chop. Through you, I just wanted to remind Member Van Rishi that the Public Health Unit did a mail out to all individuals 12 to 18 in terms of vaccine. So there was a lot of proactiveness on that end, but unfortunately it wasn't received very well by some of the public. So at this point in time, I think the biggest push for the youth would be through the mandate through the OMHA in terms of requiring that their players be vaccinated.
Okay, thanks. Dr. Strauss, I guess you can carry on with the second portion.
Sure. So, and again, being mindful that I guess I would say that I have not been fully oriented to all of this by my coworkers here at the Public Health Unit, but some things that are non-COVID have come up on my radar, and I want to let you know that they are on my radar, and I hope to have more data and things to tell you about them in the future. I think top of mind around the time that my appointment was announced, it was also announced that the local hospital would be closing labor and delivery services. I myself am interested to see how this may affect public health for pregnant women in our region. Of course, it is not for me to make the hospital makes or to question those decisions, but I do need to understand how this may affect public health in our area. So that will be a kind of a big non-COVID concern going forward, and understanding how the Public Health Unit can help out if care gaps arise. There are an increase of non-COVID diseases of interest to public health, and I had mentioned that at the media call on Monday, that where we used to see about 50 cases a month, my understanding from the historical data that the public health nurses have shared with me, we're now seeing about 70 cases a month. So, and the biggest increases, as per my preliminary understanding, are in chlamydia, syphilis, and Lyme disease. So, I think appropriately over the last year and a half, a lot of public health resources have been drawn to COVID-19. It may soon be time to draw them back in that we are, these diseases are important too. And so that will be top of mind going forward as well. Perhaps a corollary of the labor and delivery shutdown, although I hope it never comes to that, there are unfilled positions at the Public Health Unit. I don't believe that these have become of medical concern and therefore not really on my docket, but I hope that the issue of labor vacancies here doesn't become of medical concern at some point, in which case I would have to be further involved. And then just lastly to say that some, as I already mentioned, I'm reaching out to migrant worker advocacy groups. I'm hoping to meet with them going forward. And also some housing activists or advocates have reached out to me, and I'm hoping to meet with them going forward. So that's kind of the non-COVID lay of the land.
Okay, questions for Dr. Strauss? Member Van Rishi, go ahead.
I think you're muted.
Look at that. See, more buttons to push. Okay. Anyway, what I wanted to ask you was the question you started to talk about was the labor shortage that you had there, a staffing shortage. Is this something new, or is this something you've been trying to backfill, or is this natural attrition? People are just retiring, or why are we having a shortage in the health unit?
Right. I'm gonna have to rely on my previous comment that this is like this. I only sort of became aware of it in the last few days, and haven't.
Okay.
I don't understand all the intricacies of the process. So I am merely raising that it has come on my radar that there are a number of vacancies, and I guess I will say as an aside. From one of the hospitals that the hospital I was working in the weekend before I showed up here is also having a significant nursing shortage. So I guess I rather mentioned it to say, like, there are provincial and structural issues with nursing shortages going on all over the province. So, I want to be mindful of that, but it is on my docket to kind of understand what are the local contextual issues, and has it gotten to a point where I have to be concerned that the public health unit will not be able to carry on its functions?
So what you're telling me is there's been a shortage and you're looking for more staffing, or that are there people planning on leaving, or this just came on your radar and I'm just curious why.
Right. It's merely on my radar. Perhaps I have been criticized in the past for perhaps being too open about what crosses my mind. But so this has only come on my radar, and I guess I should say I'm not looking for staff that it is because my role here is medical, and so far as I can tell, there is not a medical concern with this shortage, but it has been raised as a potential issue. So I want to be mindful of it and make sure that it doesn't become a medical issue. So, but beyond that, I mean, there are managers at the health unit who have far greater understanding of what's been tried so far and what in fact is going on than myself. But I think it's good for the board to be aware that perhaps there will need to be further conversations on that point in the future. I'm not sure.
Okay. Okay. Thank you.
Thank you, Chair Chop. Just to add to what Dr. Strauss has said, I think that the issue regarding vacancies in the health unit is indicative of what's happening with health human resources across the province, not just in primary care or in hospital-based care, but in public health. Across the province since the pandemic, health units have staffed up and added additional staffing for COVID. And at the same time as the pandemic has gone on, staff working in healthcare in a variety of settings, some of them have decided to leave the profession because of stress and exhaustion. So I think it's a combination of staffing the profession and there being more vacancies available, and so there being more options available for people who are looking for work in healthcare in general, including in public health. But as Dr. Strauss said, the management team of the health unit is keeping on top of this situation all the time. Weekly at our leadership team meetings, we are reviewing vacancies and recruitment efforts, and we are engaging with our provincial associations as well to assist with recruitment. And looking at local strategies. For example, we have a student practicum program in our public health inspector team, and we have been successful in recruiting staff to temporary or permanent public health inspector positions who have been practicum students with our local health unit. So we're trying a variety of strategies in order to make sure that we have a full complement of staff.
Go ahead.
Thank you again, Buttons. Question through you, Madam Chair, to Heidi then. So Heidi, what you're telling me is we are okay at the department, or are we losing staff, or are we concerned? What are you thinking? I know you're making it a generality of a provincial thing, but I'm very concerned about us here in Haldimand, Norfolk.
Thank you, Chair Chop, through to Member Vandendriessche.
Yep.
Certainly our team has been working beyond max capacity since the beginning of the pandemic. And I'm incredibly proud of the work that the team has done. And I recognize that many people are very tired and experiencing extreme workload. So certainly when we have a number of vacancies on the team, yes, I am concerned about it and eager to get those vacancies filled so that we don't have such heavy workloads on the staff that we have.
Okay, so, okay, thank you.
Any further questions for Dr. Strauss? Thanks very much, Dr. Strauss, for joining us. Much appreciated.
Thank you.
Take care. If I could have a mover and a seconder to receive the medical officer of health's presentation as information. Member Hoffman, thanks. That's seconded by Member Taylor. Thank you. All those in favor? That is carried. Next, we have the minutes of the September 7th regular meeting and September 14th special meeting before us. I could have a motion to approve the minutes as presented. Can't see a couple people. So if I'm missing you, Member Vanden Rishi, thank you. And Member Rabbits, thank you. All those in favor? That is carried. Moving on to communications, there's two items of communication today. The first is the Health and Social Services Advisory Committee meeting schedule, and the second is the Toronto District School Board letter regarding compulsory vaccinations for eligible students. Does anyone wish to pull any of those items? Okay. Go ahead, Member Vanden Rishi. Which item do you wish to pull?
The Toronto District School Board letter. I just have the curiosity questions up, so I guess I have to pull it.
Okay. If we can have a motion to receive the Health and Social Services Advisory Committee meeting schedule. Vanden Rishi, second by Member Rabbits. Thank you. All those in favor? That is carried. And on the next item, if you'd like to go ahead.
Thank you. My concern is we received these letters, and that's all fine and good, and I understand the point. But it's not. We as a public health can't do anything on this type of thing except the school boards have direction on this. Correct?
So Board Chair Chop, through you to Member Vanden Rishi. This item is on the agenda as a follow-up to a discussion that the board had with Dr. Huckowich at his last meeting with the board, where he shared that there were some school boards that were advocating for immunizations to be mandatory for students. So that this communication is here as a follow-up. In answer to your question, if there is a topic that is covered in an item of communication that the board wishes to advocate on further, certainly the board is able to do so through a letter to the ministry or to the premier or what have you, depending on the nature of the advocacy that the board wishes to undertake.
Oh, I get it now. It just came in. Thank you.
Can I have a motion to receive that as information then? Thank you, Member Taylor, seconded by Member Columbus. All those in favor? That is carried.
Madam Chair, it's Board Member Michelle here. I'm just double checking. Can you see me on your screen?
I can now.
Okay, thank you.
Moving on, staff reports, discussion item CAO 2162, rabies investigation report requests. So we've got one staff report before the board from Mr. Klingenberg, the deputy clerk, and Kevin, I will turn the floor over to yourself.
Thank you, Board Chair Chop, through you to the board. This report before you provides a backgrounder about a proposed user fee for rabies investigation form requests, affectionately known as dog bite FOIs here at the Clerk's Department. So the report is before you because Haldeman Norfolk Health Unit is a health information custodian and is required to be a health information custodian in order to process personal health information requests. So as the consolidated service provider of access to information services for the health unit, Clerk's Department will be putting forward this user fee as a part of the Norfolk County Budget Committee deliberations next week, and the user fee will be provided there. Although this is going to be processed through the Norfolk County Clerk's Department, it is also affecting Haldeman residents, as well as there is occasional requests coming from Haldeman for the health unit as they keep their records as well. This report is to be received as information, and I'm happy to answer any questions. Thanks.
Member Hoffman, go ahead.
Thank you, Board Chair Chop. Through you to Kevin. I guess my question is, what percentage have we looked at in terms of increase? I know that there was something as well about this in the media, and I'm just wondering what number we were was an average, and where we're at now in terms of these FOIs for dog bites.
Through Board Chair Chop to Board Member Huffman. In 2020, we had about 5. If I can recall correctly. Before that, I started at Norfolk County in 2019, and I maybe 1 or 2 in 2019, so it wasn't much of a concern. It was more of a one-off. In 2020 and 2021, we've seen steady increases. In 2021 to date, we have 8 of, the report says 11, but we have a 12 FOI, so 8 of 12 FOIs is the current status.
And what would be the staff time required to process one of these FOIs for the dog bites?
Through you to, or through the chair to Board Member Huffman, it takes, I just worked with, to provide the user fee, worked with finance, and it takes Clerk's Department about an hour, maybe just short of an hour. But it's not all 1 hour at a time. It's over the course of the 30 days. And there's also some search time that would be affiliated with the health unit. And I would guess around 10 to 20 minutes to find the record and send it off to clerks.
Okay. All right. Thank you very much.
Member Van Riesche, go ahead.
Thank you. Through you to Kevin. So this is a request of, I'm not familiar with an FOI request. I know it's for information, but what kind of information? Like, you get a call that says the dog bit me. What's the next thing? Hello.
Through Board Chair Chop to Board Member Van Riesche. So the requests don't necessarily explicitly ask for a rabies investigation form, but under the Health Promotion and Protection Act, there is a requirement to follow up for purposes. So we have to keep these records, and we would have records responsive to it. It's a standard rabies investigation form that gets reported to the health unit. So to follow up and ensure that there's appropriate precautions taken for ensuring that rabies don't get. I'm not the subject matter expert of the form itself, but that's the general purpose. It is a requirement under the Health Promotion and Protection Act as a reporting mechanism to the province. And then there's also I think it's called, Heidi can correct me, but it's a Hedgehog Report, which provides all the follow-up actions that the health unit has done in order to ensure that the dog does not have rabies and is in healthy condition.
Okay. So you want to put a fee on that to be able to do those record searches?
Through the chair to Board Member Van Riesche, yes, that's correct.
Okay. Now, just a question, same topic, but if you're bit by a bat, say for instance, and I've got the bat, okay, and I put him in my little package and I run him off to the health unit, is there a charge for someone to check the bat to see if he's got rabies? I know you send it off somewhere because I've been bitten a couple of times.
Through Board Chair Chop to Board Member Van Riesche, that's outside of my area of expertise. I would have to follow up.
But there's no charge, right?
I presume not, but I couldn't tell you with absolute certainty.
Okay, just checking. Thank you.
Any further questions? Great. If there's none, if I could have a motion that staff report CAO 2162 regarding rabies investigation report request be received as information. Member Taylor, thank you. Member Martin seconded. All those in favor? Carried. And moving on, if I could have a motion on bylaw 2021-21BH being a bylaw.
Through Board Chair Chop, we do need to do the rescheduling of the November 2nd board meeting. We will need a motion for that. Sorry, I didn't give that to you, but it'll be the same motion as the addition item.
One sec. Let me come back to it. So a motion to reschedule the regular Board of Health meeting from November 2nd, 2021 to November 9th, 2021, commencing at 9 a.m. Mover and seconder. Member Michelle, seconded by Member Taylor. Thank you. All those in favor? That's carried. And back over to the confirming bylaw, which is 2021-21BH being a bylaw to confirm the proceedings of the regular Board of Health for the Haldeman Norfolk Health Unit at this Board of Health meeting held on the 6th of October 2021 be approved, signed by the chair and board clerk, and affixed with the corporate seal. Mover and seconder, Member Taylor, seconded by Member Van Passen. All those in favor? That is carried. And finally, a motion to adjourn, please. Member Huffman. Seconded by Member Taylor. All those in favor? And that's carried. Perfect.